You have seen a lot of
Yeah.
in orthopedic, lot of
Yeah.
cases of amputation, non-healing ulcers.
Let me summarize for the audience benefit. Okay, the important complications of not managing your diabetes properly are, to start with, very important is your vision. As explained, retinopathy, that means you are going to be blind, you are going to lose your vision in long term if you are on a hyperglycemic status. That is one. Second thing is your heart. People can get into cardiac diseases. What that could be? Sudden cardiac, silent cardiac and arrest and death. They go for triple vessel blockages, and then one has to go for angioplasty or open heart surgeries, all those stuff. That's another complication which is important. It can also happen to your skin. You can have skin complications. You can also have lung complications. Lung will go for sclerosis and that sort of things. That is another problem. Then one can have problems with the nerves and the blood vessel, which can take care of your limbs periphery. The blood supply is always through the blood vessels, and the sensation to your leg and hands are through the nerves. When these things are disturbed because of the high cholesterol levels, associated high cholesterol levels and sugar levels, what happens is there is a destruction. The flow of blood to the areas are less. When the area is not oxygenated well, when the areas, lower limbs and upper limbs are not blood supply is not good, not well vascularized, then what happens is there is something called as a pressure. Okay, initially there will be trophic ulcer, pressure ulcers. Then it goes deep, it will become a small ulcer. Then it spreads, it will become a bigger ulcer. It goes down to the extent of leading up to the bone. Okay, these ulcers can lead up to the bone. So then we have to get in and then go for amputations and then remove your limb. It's a very debilitating situation for any individual and family. And the magnitude is so high in India, it is unfortunate to see people losing their hand, people losing their limbs, people losing their eyes, people losing their kidney. Okay, the kidney burden today because of diabetes is too high. One dialysis on an alternative day in an individual's family, it's very difficult. Somebody has to carry them, somebody has to ferry them to the hospital. There is a transport expenditure and loss of labor for somebody who is accompanying. Not only the expenditure in the hospital, the indirect loss to the family and to the society and to the government and to our exchequer is too great. So magnitude is too great. People have to understand this point. Okay, all these things can be prevented very well if you have a right knowledge about the disease. One need not worry about diabetes. Okay, diabetes is a lifestyle disease. Change your lifestyles. Unfortunately, for some people it can be genetic. For small children also nowadays we are seeing, that is juvenile diabetes, which can be very well managed by appropriate medications. If you start early with insulin injections for these people, now we have various skin monitors, we can apply patches and then monitor the sugar levels and appropriately we can treat it. If we educate the people about how to take care of their sugar levels, how to manage diet, and then exercises. Okay, with all these things it can be managed very well.
In a nutshell, to give solutions for our viewers, we can remember simple 5 words: A, B, C, D, E. So A means A1C, that means HbA1c. If you maintain our HbA1c, that HbA1c gives a 3 months control of our diabetes, that is the mean glucose level. So if you have under 7, 6.6, 6.5 is okay. So if you have HbA1c level under 6 or 7, it is very good. Your diabetes is controlled over a period of 3 months. So that gives the value. Then you have blood pressure. If you are having hypertension, you have to take medications, avoid salt, pickles and salt content foods.
Yes. So, to add a point here, 11.2% is the load of diabetes in this country, the percentage wise. At the same time, the hypertension is around 32 to 34% of the Indians are suffering from one or the other cardiac disease. A deadly combination of sugar, which is 12%, a deadly combination of hypertension, which is around 32 to 35, adding up to around 45. That means essentially we have people suffering from diseases which is equivalent to 50%.
Okay.
Imagine the other diseases. Okay. So 50% of the disease populations we are carrying. That is too much of a burden in a nation. Okay.